A surge in COVID-19 cases has led to pandemic area mandates returning in some places. Mask mandates making a comeback in some parts of the nation as COVID-19 cases continue to rise. Chief Health and Medical Expert Dr. Leah Croll joins us live now with more on the newest subvariant and good hygiene practices for the fall. Good to see you. And this is very timely because I know we are hearing about this new subvariant. Some people are deciding, should I take it lightly? Do I need to bring the mask back? We're going to take it right to you. What should people know and what should they be doing right now?
Good morning, Maureen. Thank you so much for having me. So there are these transmissible, meaning contagious Omicron subvariants running around right now. The BA.2.86 variant is the one that scientists are watching most closely. There's only been a handful of confirmed cases in the U.S., but it is a variant of interest because it's so contagious. I want to be clear, though, there's no indication that it causes more severe or more serious disease than any of the other strains of COVID. In terms of what people can do, this is the time to double down on what we know already works. Stay up to date on all of your vaccinations, including the new COVID booster that's coming this September. Wash your hands, wear masks when it's appropriate, test when you feel sick, and stay home if you test positive for COVID.
So I know people are hearing this, especially when they said this is not any more deadly. Maybe some people say, okay, I'm in the clear now. I don't have to take this as seriously. You do have a very stern warning about that. You just said, do not give up on these precautions because while it may not be deadly, you could still get very sick.
Absolutely. You could still get very sick and you could get vulnerable people around you sick.
Right.
Okay. So I really want you to pay attention to what your personal risk is. Are you someone who is immunocompromised from a medical condition? Are you in the elderly group? Are you a cancer patient on chemotherapy? Right. If you fall into a higher risk category, then you definitely want to have your guard up. You definitely want to remain vigilant. And if you know that you're somebody who's going to be around people who are more vulnerable, if you're around young kids, if you're around the elderly, you absolutely want to take that into account when you think about whether or not to wear a mask.
So I know doctors and people said, look, I got the first booster shot, I got the second one, I didn't get the subsequent ones. Can I still go ahead this fall and get a shot? Will I be okay? Talk about that, because I know there's some confusion about if I've missed a couple, can I still take one now and be fine? What do you say to that?
It is confusing, and here's what I say. For most people, the right thing to do is going to be to wait until this new booster comes. I think it's coming in the next 2 to 3 weeks, because this booster will protect against some of those Omicron variants that are currently circulating. So that's the one that's really going to give you the most bang for your buck in terms of protecting you from severe disease, okay? Now, for some people, they may not be able to wait until September, and those are higher risk individuals. So if you fall into one of those more vulnerable categories we talk about, I recommend you touch base with your doctor and you get their take on whether they think you should get the vaccine that's just available to you right now, or you should wait until later in September.
Great advice, and I do hope people heed it because, yeah, COVID looks like it's here to stay permanently. We just have to learn to live with it and practice good hygiene practices and just get those vaccines if you can. Dr. Leah Croll, thank you so much for your time this morning. We appreciate the insight and the tips.
Thank you.